Oh, yeah.
What is up, everyone? Welcome back to Kanika RN. This is the fourth video in my series of 5 videos on taking and passing the NCLEX in 75 questions or as few questions as possible. I have linked the first 3 videos down in the description for you, so you can go right on over there and check them out. In the first video, I talk about my NCLEX taking experience and how I passed in 76 questions, not 75, but the whole purpose of these videos is for you to be a little bit better than me and be able to rub it in my face that I got the 75. So go ahead and check out that first video if you want a little bit of insight into my experience. In the second video, I go ahead and I give you a really detailed study plan, and I also give you my top 2 resources for passing the NCLEX in as few questions as possible, and I also give you a link to a practice test. So that is a great resource if you are someone who's just out of nursing school and you're trying to form a plan in your brain of how long before the NCLEX do I need to be studying, how many questions per day, how many practice questions that is per day I need to be doing, and just overall I give you a really solid 30-day plan on what you need to do before you take your NCLEX. So that is the second video in this series. The third video in this series was basically me giving you test strategy, just sort of general test strategy on how to take different kinds of questions and answer them, and how to avoid some common mistakes that some people make while taking the NCLEX, and also how to kind of navigate through some of the ways that NCLEX might try to trick you. So that will tie in very nicely with this week's video, where we go over 8 sample questions in which I will teach you how to take the concepts from last week's video and apply them to actual questions. So in case you haven't seen the third video, I highly recommend you check that out first. It's in the description. The other 2 videos are also going to be helpful for you, but I highly recommend you see that third video before you hop into this one. And if you're ready, let's get to it. So you should be seeing the very first question pop up on your screen right now, so I'm just going to read it out. The healthcare provider is caring for a patient who has septic shock. Which of these should the healthcare provider administer to the patient first? And your answers are corticosteroids to reduce inflammation, antibiotics to treat the underlying infection, IV fluids to increase intravascular volume, and vasopressors to increase blood pressure. So go ahead and hit that pause button while you think over this. And whenever you're ready to rejoin us, just hit that play and we'll go over the correct answer and the rationale for that answer. And that will be the same pattern we'll follow for all of these questions. So go ahead and hit that pause button and hit play when you're ready to rejoin. It's a classic question on the NCLEX where you have 4 potentially right answers. There's not necessarily an answer that is wrong or that is just completely easy to throw away. So let's go one by one and figure out which is the most essential intervention, because that's what you always want to be thinking about. If all of these are correct, what's the most important to the safety and the well-being of the patient? So let's go over this question and let's choose the best answer choice. So the first answer choice, corticosteroids to reduce inflammation, this is a valid answer, but it's not a priority intervention. Remember, you always want to prioritize circulation, airway, breathing, and if any of these answer choices will address patient circulation, airway, breathing, then we're definitely going to prioritize those first. So corticosteroids to reduce inflammation may be done at some point in their treatment, but it's definitely not the most vital thing to do right now. Antibiotics are also going to be started pretty early on, but remember, even though that's not an answer choice provided, this is just general nursing knowledge that you always want to make sure blood cultures are drawn before you ever start antibiotics. So antibiotics is a reasonable choice, but let's see if something else addresses a more immediate need first. IV fluids to increase intravascular volume and vasopressors to increase blood pressure. So sepsis protocol will always dictate that you replace intravascular volume first. And how does this apply to circulation, airway, breathing? It's not coming right out and telling you this is a circulation question, but this is a circulation question. So what happens during septic shock? The patient vasodilates and their blood pressure drops. When their blood pressure drops, their circulation is compromised and their organs aren't being perfused adequately. There's not enough pressure to perfuse the organs. So those organs are going to start deteriorating. So the most important action for the nurse to take is to start IV fluids to increase that intravascular volume and to make sure that the circulating pressure, the blood pressure, maintains at an adequate level to perfuse all those organs. So definitely sepsis protocol will dictate IV fluids, and just if you kind of logically work through this is going to be the answer that will address that circulation, airway, breathing. So the correct answer is going to be IV fluids to increase intervascular volume. All right, question number 2. A patient diagnosed with depression is prescribed an MAOI when teaching the patient about the medication. Which statement made by the patient indicates the need for additional teaching? So I talked about this in the last video, that anytime you see the statement, patient makes a statement that needs further education, patient makes a statement that needs clarification, in your mind you should be thinking, ding, 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 this patient has said something incorrect that I need to clarify or reteach them. So you'll be looking for the incorrect answer. So that does seem a little bit trippy and for a second of like, I'm looking for the wrong answer, but always remember when it says you need to clarify, you need to provide further education, you'll be looking for the incorrect answer. Let's go through these answer choices. I don't have to limit the pepperoni on my pizza. I'm glad I can still eat hamburgers and french fries. I can still eat out at restaurants as long as I'm careful, and I will miss putting soy sauce on my noodles. So if you remember that one of the things that patients have to restrict with an MAOI is they have to restrict their tyramine, which is a substance that makes it so that the medication doesn't work appropriately. So let's say for some reason you can't remember which foods has tyramine, or you can't even remember that that's a thing that patients on these types of antidepressants have to avoid. The answer choice, I can still eat out at restaurants as long as I'm careful. There's nothing really wrong about this statement in general, no matter what the question is. So you can pretty much throw that out. Of the remaining 3 answer choices, I don't have to limit the amount of pepperoni on my pizza. I'm glad I can still eat hamburgers and french fries. I will miss putting soy sauce on my noodles. So if you can go through these answer choices, the first one about the pepperoni and the last one about the soy sauce, if you can remember that pepperoni and soy sauce, they're both, pepperoni is cured, soy sauce is fermented. They kind of fall into the same category of foods that need to be restricted on certain medications. So if you see that these are kind of opposing each other, it's likely that one of them is the correct answer. So my guess in this instance is I don't have to limit the pepperoni on my pizza. I know that tyramine needs to be avoided for this kind of antidepressant, but I'm looking at these 2 answer choices and it's most likely that the patient is going to have to restrict something. So I would lean towards the answer that says I don't have to limit this, I don't have to do this, and that's if it's a pure guess. Ideally, you would know that tyramine needs to be avoided for these medications, but the best guess in this question, if you can't remember that information, is the I don't have to limit the pepperoni on my pizza, which is actually the correct answer from a medical standpoint. All right, question number 3. The healthcare provider is caring for a patient on a ventilator with an endotracheal tube in place. Which assessment data indicates the tube has migrated too far down the trachea? Our answer choices are a high pressure alarm sounds, low pressure alarm sounds, decreased breath sounds on the left side of the chest, or increased crackles, auscultation bilaterally. So go ahead and pause and we will come back in just a second. This question is basically analyzing your knowledge of anatomy and physiology, particularly of the lungs and particularly of the airway. So if there's 2 areas of the body in the NCLEX where you're really gonna get down to your anatomy and physiology, it's this section of the body. So you definitely want to be familiar with your airway, your cardiac system, and things of where your liver is located, gallbladder is located, pancreas is located. Overall anatomy and physiology is very important to know, but definitely this core area is where a lot of your anatomy physiology is going to come into play on the NCLEX. So in this question, it's important for you to know that the right side, the stem of your lung, is a little bit longer than the left side. So if the tube has migrated too far down the trachea, it's very likely that it's migrated into your right lung, which would mean that you would have decreased breath sounds on the left side of your chest. High pressure alarm would most likely be if there's a kink in the system, or maybe some moisture buildup has happened in the system. Low pressure would be if there's a disconnection, most likely some kind of tubing has become disconnected. Increased crackles bilaterally, again, would be more likely of an infiltration in the lungs or something like that. But if you can remember the physiology of your right lung, then if the tube has migrated too far down, it's most likely to have migrated into your right lung, which would mean that you would have decreased lung sounds on the left side. So that would be the correct answer, decreased breath sounds on the left side of the chest. Okay, question number 4. During an assessment of a patient experiencing acute hemorrhage, the healthcare provider would most likely expect to find nausea, jaundice, hypotension, or tachycardia. So this is a great question where you kind of have two good answer choices, but one is better answer choice. So nausea and jaundice is not something that's really seen during an acute hemorrhage, and if it is, that's not something that we're going to address first. It's not going to be one of the first and priority signs and symptoms. So hypotension and tachycardia, both of these are very important and will most likely be seen during an acute hemorrhage, but you want to remember that during a hemorrhage, tachycardia will most likely be seen first. Because if you're losing volume, the body's going to try to compensate by increasing your heart rate. And then if the body's not able to compensate, and if there's enough blood coming out of the system, then your blood pressure is going to start dropping. But the first thing that you're going to see is tachycardia. So that would be the correct answer in this case. So the correct answer is tachycardia. Move on to question number 5. When evaluating the arterial blood gases of a patient with a 20-year-old history of chronic bronchitis, which of these would the healthcare provider expect? A, respiratory acidosis compensated. B, metabolic acidosis uncompensated. C, respiratory alkalosis uncompensated. D, metabolic alkalosis compensated. Let's go and hit that pause button, and whenever you're ready, go ahead and hit play and rejoin. This is a fantastic example of a question where even if you only have pieces of the puzzle, you can still solve this question in many different ways. So let's say first of all, arterial blood gases are something that you should know front, backwards, upside down, in your sleep, blindfolded. So many questions on your NCLEX are going to relate to arterial blood gases, and it's just such a solid piece of information that will help you answer many different questions. So definitely get very comfortable with arterial blood gases. But in this question, even if you can't remember everything about arterial blood gases, you can still answer this question correctly. So let's look at the diagnosis. Chronic bronchitis. Chronic indicates this patient has had this condition for a long time, and if they've had this condition for a long time, most likely the condition is likely to be compensated. So you can already go ahead and throw out answer choice B and C because both of them are uncompensated. The patient has bronchitis, which indicates it's a respiratory issue. So even if you can't remember anything about blood gases, you can still answer this question correctly. It's chronic, so most likely it's compensated. Bronchitis, so it's a respiratory issue. So our only two left are respiratory acidosis compensated or metabolic alkalosis compensated. We already know it's a respiratory issue and compensated. There's only one answer choice that has both of those. So that's already answer A. Even if you can't remember acidosis, alkalosis, even if you can't remember any of that, you can answer the question correctly. But if you really, really know your stuff, you're going to know that with bronchitis, they're going to retain, they're not having as much airflow out, so they're going to retain carbon dioxide. And if they're retaining carbon dioxide or CO2, their blood is likely to become acidotic, or it will become acidotic. So it will become an acidosis problem. So the correct answer would be respiratory acidosis compensated. But this is such a great example of a question of, even if you don't have 100% of the information, if you can't recall which condition would lead to acidosis, which condition will lead to alkalosis, you can still answer this question correctly. So the correct answer is respiratory acidosis compensated. Okay, question number 6. The healthcare provider is seeing 4 patients at the neighborhood clinic. Which of these patients should the healthcare provider identify to be more at risk of iron deficiency anemia? A, the woman of childbearing age reporting a craving for ice. B, the patient who has a diagnosis of chronic renal failure. C, the obese patient with a history of gastric bypass surgery. Or D, the patient who follows a strict diet. So go ahead and hit pause and hit play when you're ready. So this is a great example of a question that I was talking about before in the last video, that you don't want to make any assumptions about anything. You want to take the information at hand and just base your answer off of that. So I do think there might be a temptation to choose the answer, the patient who follows a strict vegan diet, because sometimes if you're not supplementing enough iron in your diet, you're not having enough green leafy vegetables, you're not having enough lentils, or you're not having iron-rich foods, and that could happen to a person on a vegan diet. So even though you might initially feel the instinct to lean that way, that is not the correct answer in this case. So of the answers left, with a patient with gastric bypass, they're going to have more issues with their B12 absorption, not so much iron, and that's just something that you would have to know about that condition. With chronic renal failure, again, that's not going to be as much of an issue. A craving for ice in women of childbearing age, or a craving for non-food substances, if you remember that from your OBGYN studies, it's called pica or pica. I can never remember the exact pronunciation, but it's basically a craving for ice or clay even, or just different non-food substances. And that usually indicates an iron deficiency. So that is a diagnosed condition, and that is just something that you would have to remember. But the one answer choice that you can go ahead and immediately throw out is the patient who follows a strict vegan diet, even though when I first read that question, that's the way I was leaning. But you can't make the assumption that that patient is not having enough iron in their diet just from that alone. So the correct answer in this case is the woman of childbearing age reporting a craving for ice. Okay, now we're going to move on to a couple of psychosocial questions, and this is what I was saying in the last video of, I think at times they can be perceived as being tricky, but I think with practice you will find that these become the easiest questions simply because you don't have to memorize a lot of information in order to answer these correctly. Always be thinking in your mind, as a nurse, which of these is the ones where I'm putting my biases, my inferences, the least amount on the patient. So always kind of be thinking about that in the back of your mind. So question number 7, during a discussion group on the psych unit, a female client suddenly becomes upset and leaves the group yelling, "Everyone here hates me. What should the nurse do?" A, require the client to return to group and discuss her concerns. B, after group, approach the client to talk about her feelings. C, describe the client's situation to other group members. And D, ask the other group members to apologize for upsetting the client. So this is a great eliminate one choice at a time kind of question. So the first one, require the client to return to group and discuss her concerns. Confrontation in this sort of environment is just going to lead to escalating. It's going to make the patient feel like she's being targeted. It's going to make her feel embarrassed, and that's something you want to definitely avoid if possible. So we can go ahead and throw out question or answer A. Let's move on to C, and then we'll go back to B because that is the correct one. Describe the client situation to other group members. Absolutely not. That's a HIPAA violation, and that just violates your code as a nurse. You're not supposed to discuss a patient situation with any other, even if your intention is to say, like, please excuse her, she has such and such. The intention may not be bad. You may be trying to explain to the other people's, like, please don't be upset at her, she suffers from XYZ, but you definitely don't want to do that. You're not at liberty to do that. And the last answer choice, ask the group members to apologize for upsetting the client. There's nothing in this question that indicates that they've done anything to upset her, so this is not even relevant to this question. The best way to tackle this, it seems that this woman has issues with self-esteem, with being targeted in general, so you definitely want to avoid having any sort of group discussion or making her feel like she has the spotlight on her in any way. You definitely want to discuss her feelings in private, in a closed setting, and that's going to be the safest approach for this patient. So the correct answer would be, after the group, approach the client to talk about her feelings. You don't want to dismiss this. You don't want to just let this slide. You definitely want to talk to the client further about what other things is bringing this on, what interventions will be needed to be set into place, but you definitely want to do this one-on-one. And for the very last question, during a group therapy session, a client with heroin addiction states, "I've caused my wife and kids so much pain. I'm such a loser. What is the nurse's best response?" So A, drug dependence affects the whole family. B, addiction is a treatable disease. C, eventually they will forgive you. Or D, you're going to have to earn their trust again. So there are two answer choices that we can throw right out because they put too much of an inference on the patient. We're assuming things about the situation that aren't necessarily true and are not things that we should be making an inference about anyway, even if they are true. So C, they will eventually forgive you. That's not really our place to get into whether or not the family will forgive them, whether or not there's even something the family has said that they won't forgive him. You know, that's not really a therapeutic response for us as a nurse to make. And then D, you're going to have to earn their trust again. Again, we can make assumptions about whether he's broken their trust, and we have to focus more specifically on the patient and what can be done for the situation. So this is not really our position as a nurse. This might be more of a psychiatric type setting where a therapist might be talking about these things with them, but not us as the nurse. So between A and B, drug dependence affects the whole family, or B, addiction is a treatable disease. Both of these are relatively neutral statements. Both of them could be helpful in this scenario, but you always want to go with the most neutral statement. Again, drug dependence affects the whole family. It's not necessarily our place to infer that this is affecting his family. So the most neutral and also the most conducive towards treatment, the most conducive towards a positive outcome is going to be addiction is a treatable disease. So you're very just generally telling the patient that whatever condition you have, it can be treated. We're not placing any inferences based on his family dynamics. We're not telling him anything else about his family situation, making any inference about his family situation. All we're saying is that this issue that you have, there are treatment options for it. So it's the most general, placing the least amount of inferences on the patient. So the correct answer in this case will be addiction is a treatable disease. And with that, we've come to the conclusion of these 8 sample questions. Hopefully going through these sample questions has kind of provided you some strategies on how to best answer NCLEX style questions. And as you work through practice questions, and make sure you're always reading the rationale, even if you answered the question correctly, because you want to make sure that the reason you answer a question correctly isn't because of false information or a lucky guess. So I would suggest don't try to blast through like I did 100 questions today, I did 125 questions. It's way more effective to just do 20 or 25 questions, but really understand the content of each one and really understand the rationale of each question. So the final video in this series is where I'm going to be giving you tips for the day of the NCLEX, the day before and the day of, I guess, of the NCLEX, when all your studying is done. No more studying needs to be done at this point, and that's going to be the final video in this NCLEX series, so that's going to be coming out next Thursday. So go ahead and subscribe and hit the bell icon if you have not already so you don't miss that video. If there's any other questions I can answer for you, any other resources I can provide for you, then please go ahead and comment them below. I would love to help you in any way I can. And as always, my friends, keep it sweet and salty, and I'll see you guys next Thursday for the last video in this series.